How's it going? Levi here with ontheregular.com, and it's been a little while since I've posted, but as you know, I've got some juicing recipes and things like that on YouTube, and that's what I specialize in my blog. And something that's just helped me quite some time ago get remission with my ulcerative colitis. But there's actually been a lot of changes that have come up, and so I'm going to ask you to go to the blog and check out the new post that I have, because I'm basically going to tell you my story about what's happened over the past 6 to 7 months. And today is November 3rd on a Sunday, and basically what happened was back in January I accepted a new position with my company because I was in Louisiana at the time, and this is now in Chicago. So after accepting that, we're going to make the move in about March, actually. And what happened was during February, I had to get on the road and travel quite a bit. And over that 4 to 5 weeks on the road, I got completely off my schedule. I got off of juicing, and really I was eating out at restaurants 3 meals a day. Now I still try to stick to gluten-free, and which I do regardless, but anytime you eat at a restaurant, you try to eat at the better ones, but you just don't know where their food is coming from. So that was something that as I started to travel, I started to experience some urgency again, and I just didn't really think it was that concerning. So whenever I got home, finally we came up in March and moved up to Chicago in March. I started to kind of get things back under control. Well, April and then May came, and what happened was in May, my wife and I went to the Dominican Republic. So, and the day after we came back from there, it just hit me like a ton of bricks, and all of a sudden, I ended up in the bathroom probably about 15 times a day for the next 3 days. So much so that I had to go to the hospital for dehydration within 3 days of coming back. And even though I was there and got my fluids and everything, I came back home and everything just started right back up again. So it was just really tough to kind of go through that. And as you know, if you've been through a flare before, it's pretty horrific. And this was actually my first flare. I've had ulcerative colitis since 2005. I've maintained it with just diet and exercise, and have never really had a problem. And I haven't really been on any medication. I'm not on any medication now. Done everything natural. So it was just new to me, so we didn't really understand what was going on, except for the fact that I was starting to get really, really sick. And that's what happened. So anyways, long story short, I had lost about 50 pounds through this ordeal. And I'd gone to the hospital 3 times actually for dehydration. Got a colonoscopy in mid-June, and my colon looked like hamburger meat, the entire thing. It was horrible. It scared me because my last colonoscopy 2 years ago was pretty clean. There really wasn't any inflammation or anything of that nature. So, we were just very concerned. And the GI doctor I was seeing at the time, he flipped out as well. And he immediately wanted to put me on Remicade, which, as you know, is a chemo-type drug. And my wife and I just really did not want to go that route. And so we ended up firing the GI doctor just because not only did he want me on Remicade, but he told me if that didn't work, I should consider removing my colon because it was so bad. And, at 34 years old, that's just not really an option for me at this point. I just feel like there's still a fighting chance. I wanted to give myself and my colon to make it through this. So anyways, we started seeing a chiropractor. Now here in Chicago, chiropractors, if they're licensed as a physician, they can treat any illness as long as they don't use medication or surgery. And I started to see this doctor every week for about 8 weeks, and he practices applied kinesiology, which is where he does muscle strength testing and also tests your nervous system to understand what's wrong in your body and what type of supplements you'll need to get that backed up. So anyways, he started to help me get better, and then about 8 weeks or so after that, I was getting better, but it was a very, very slow process. And I'll tell you what, I was in immense pain for a couple of months there. Like I said, losing 50 pounds, it was a lot. I mean, I just completely shriveled up, was very, very sick. If you go to the blog, I'll actually post some pictures on there for you. And I was just in constant pain, constant cramping. And there was times that I'd go to bed at night, and I honestly didn't think I was going to wake up. I mean, I just thought that there's no way my body's going to be able to handle this anymore. And it's just, unless you've been through it, it's very hard to describe the pain that comes with it. I mean, I wanted my whole midsection cut out. I mean, not that we were going to go that route, but that's how bad I felt. So, working with this chiropractor, he was helping me get better, and he helped my crampings to stop, and figured out that I was actually had a couple of parasites in my gut, which none of the GI doctors could figure that out. And that's what was causing my severe cramping and constant trips to the bathroom and everything. Like I said, I was still going about 15 times a day. Wasn't sleeping, hadn't slept in months because I was going to the bathroom every 1 to 2 hours at night. I mean, I'd just wake up and have to go. So, with that being said, he recommended us a health food store in Chicago to go to possibly, pick up some of our other supplements and things like that. And so we did. And there we happened to run into the owner of the health food store, which also has a chiropractor on staff. And this doctor actually does electroacupuncture and actually can scan your entire body to figure out exactly what's going on. So we decided to see him as well. And this was just absolutely amazing what this doctor can do, especially in the natural realm. So what happened is he ended up going through about a 3-hour test with him, and he found all the things that were going on in my body. And what happened, kind of like his statement is, like he said, is I really don't have ulcerative colitis. I have some type of infection or other type of problem that's, causing my immune system to go haywire, or the inflammation to stay in there. So when the scan was done, he had found about 200 different things going on in my body. And this ranged from pesticides that you breathe in on a daily basis, whether you're outside or, as some people do, they put on makeups or deodorants or things. Well, all that stuff contains chemicals and pesticides. So he found traces of pesticides. I still had some parasites. I had fungus overgrowth. I had yeast overgrowth. I had long-term or internal hidden tooth infections on 4 teeth. And he said this was something that the dentist would never see with an x-ray, or never be able to see with the blind eye, but they were just deep-rooted infections that were just down there in the roots, just kind of hanging out. And then, of course, also problems in my intestines and whatnot. But like I said, he's able to pinpoint the exact problems. These parasites that I had were just small. They weren't causing me really problems at this time, but they're small enough to cause problems in the rest of your body. The fungus overgrowth, the yeast overgrowth. Some of you should be familiar with things like yeast overgrowth if you follow SCD diet or something like that. That's the whole premise behind that, is any undigested food left in your body, can cause an overgrowth of yeast or fungus, or just bacteria and things like that are not good for you. So anyways, what he also does is then, once he finds all these things, is the premise is that everything in your body contains an electrical charge, including parasites and pesticides. Oh, the other thing I also found too was lingering heavy metals in me as well. So I've got some old mercury feelings from whenever I was a kid, which I'm going to be having removed. But he found some mercury lingering in my system whenever I deployed to Iraq in 2005. Of course, they shot me up with 10 different vaccinations at one time. He found some lingering heavy metals from the vaccines at that time. So, with all that being said, all those things contain an electrical charge. The parasites, the funguses, the yeast, the heavy metals, the infections, they all carry an electrical charge. And his system, because it's able to pinpoint it exactly, knows exactly the opposite charge to program and to kill the parasites, bacteria, yeast overgrowth. So it's able to do all this painlessly. And I'll show you right now. I happen to have on my leg one of the cards. And what happens is he programs these cards, as you can see there. It's programmed on the magnetic strip there, and you would just place this with a type of bandage or something like that against your skin, and the treatment is 5 hours a day for 20 days. I happen to be wearing a bandage around my legs right now, and I've got the cards on my legs, and I'm actually going through the second treatment now, but it was just amazing because after the first treatment, within 7 days, my bowel movements completely changed, and after completing the 20 days, I had gained back 25 pounds just within that 3 weeks. And I was eating again. My bowel movements changed. I stopped having diarrhea. My stools changed. They started to be more formed. So it was just amazing. And anyways, I go a little bit more into detail on this on the blog, so I'm going to ask you to just go to the blog and check it out. Leave any comments if you want, and I'll be able to answer your questions if you like. If you're in the Chicago area and you like to see this doctor, it's unbelievable, I think, what he can do within a short period of time and change the whole make of your body. If you've had stuff going on for years and nothing seems to work, it could just be that easy as you have a simple infection or parasite or fungus or yeast overgrowth or something that's actually causing those problems, and that's something that a medical doctor would never pick up. But he can pick it up, program the opposite charge on there, and get it out of your body. And I'll tell you, it could be a tremendous help. So be sure to email me with any questions, to leave comments, and I'll answer them. And also, like I said, check out the blog at ontheregular.com for the full story. There's actually some more tidbits in there that I left out here. So that's it for now, guys. I appreciate it. I appreciate all the views on the juicing recipes and the juicing videos. And I've had a lot of comments and feedback, positive, on those. And we just got to keep fighting the good fight. I know medication and doctors have their place, but for me, just those types of things, as far as being on medication the rest of my life and surgery, they're just not really an option. So for us, this was the right way to go, and now I'm better. I'm not on any medication. I didn't have to have any surgery, and I've actually gained back 40 pounds now. My weight before was 190. I'm 180 right now, but I dropped all the way to 140 pounds. And like I said, it was the worst I had ever been. It was very, very traumatizing for myself and my wife during that time. So, with that being said, I believe there is alternative ways to heal, and I want to keep my colon as long as possible, and I think this is going to help out. So, appreciate your time today, and look forward to hearing from you, and I'll talk to you soon.